My name is Jenny Helm and I'm one of the clinicians here at the Small Animal Hospital at the University of Glasgow. When we think about lungworm, we're talking specifically about Angiostrongylus vasorum lungworm here, and that's a type of lungworm which dogs can catch actually from slugs and snails. What I feel is most important about that lungworm is that that lungworm infection is potentially fatal to dogs, so it's very important to raise awareness and that pet owners are aware of this type of lungworm. So recently we undertook a study in looking at slugs and snails in local Glasgow parks. We took this upon ourselves because there was some feeling that we didn't know how much lungworm we were seeing in Scotland at the time. So with colleagues at the University of Bristol, we decided that we would survey slugs and some snails in some of the parks within the perimeter of Glasgow. So the key findings of our study, really the overall finding, was that we proved that we found lungworm larvae in slugs in 3 parks in the Glasgow area that are really popular with dog walkers. So for dog owners, it's important for all dog owners to aware that this lungworm can affect all breeds, all ages, all types of dogs. One of my biggest messages as a vet is to make them aware that of the potential clinical signs that lungworm is out there, make sure that they're very aware of that, also make sure that they're aware that there are worming products that can be used to prevent lungworm, so it's important that they speak to their own vets about that and really choose a worming regime that is suitable for their dog and their family, so spend some time talking to their vets and working that out.
My name's Alexander Heron. I come from a village called Comores, which is in East Ayrshire. My dog's name's Nushka. She's a 3-year-old Shih Tzu. When I first became aware that Nushka was unwell was just shortly after she was clipped. She kept on going back to her tail. Within a couple of days of that, she didn't want to actually walk. This drew her attention to the fact that we'd maybe be better getting her to the vet to get her checked. I was totally unaware that lungworm was even an illness in Scotland for dogs at that time. Until my dog actually contracted it. And Nushka was admitted just before Christmas and she was in there for bordering on nearly 78 days she was in there, and even after that she still had to be taken back for blood tests and oxygen levels checked and that. Everybody in the family was devastated because we only had her about 9 months. And it was like one of the children or something like that, because that's what the other babies knew in the family, so we thought we were going to lose her. She's a wee bundle of joy, and just every now and again you've just got to remember yourself that she's still an invalid to a degree, and even to this day she's still on blood tests and long-term medication for this. The advice I give to other dog owners is be very, very aware of your dog's change in behaviourism for any reason whatsoever: breathlessness, lethargic, looking up in the air. Check what treatment that you're given. Go to your local vet, because sometimes the treatment that you're using isn't the one you should have.